Part A. Extract 1. Questions 1 to 12. You hear a pharmacist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How can I help you today?
Oh, thank goodness. Good morning, Robert. I'm here because I'm really concerned about this swelling that just doesn't seem to go away. It's been really uncomfortable, and honestly, I'm starting to get worried. It's been lingering for days, and the pain, well, I guess it's more of an itching, burning feeling that's just getting worse.
I see. Could you describe exactly where the symptom is and what it feels like?
Absolutely. It started on my left forearm, near the wrist, and the area is really puffy and inflamed. Initially, I thought it might be a rash, but it's very localized, almost as if it's confined to this one spot. The skin around it feels unusually warm, and at times, it's a bit tender to the touch. But what's strange is that it doesn't look like a typical rash. There are no red spots, but it's noticeably swollen and even a bit shiny.
That does sound uncomfortable. How would you describe the symptoms?
It's a persistent kind of itching, almost like when you have a strong allergic reaction. And it's hard to explain. I feel like a stinging sensation, as though something is irritating the deeper layers of my skin, not just the surface. The itching comes in waves, but the stinging seems to be constant.
Okay, got it. So, has this spread or changed in any way since it first appeared?
Yes, actually. At first, I thought it was just a mosquito bite, so I ignored it. But then it started spreading slightly upwards toward the elbow.
Oh, I see.
And now it feels almost, I don't know, kind of hard? Like there's fluid building up beneath the skin. I'm also noticing that I feel slightly warmer than usual, almost feverish, though I haven't checked my temperature.
Understood, Mihira. Have you tried any treatments or remedies so far?
Oh yes. First, I used a basic hydrocortisone cream, thinking it would calm the itching. I also tried an ice pack to reduce the swelling, but neither seemed to have much effect. Then I took an antihistamine pill, diphenhydramine, to manage the itching, but it just made me feel sleepy without really reducing the symptoms. Finally, I applied some aloe vera gel, thinking it would soothe the irritation, but even that didn't help. At this point, I feel like I'm just trying anything I can think of.
I see. And Mihira, are you currently on any medications or managing any other health conditions?
Yes, I do take a low-dose aspirin daily for heart health as recommended by my GP. I also occasionally take ibuprofen for headaches, but I haven't taken any since this swelling started. Other than that, I'm on a mild prescription for hypothyroidism, levothyroxine, 50 micrograms every morning on an empty stomach. I've been taking that for over a year now without any issues. I'm careful with medications because of my thyroid.
That's helpful information, Mihira. Based on what you've described, it sounds like this could be an allergic reaction to an insect bite, possibly causing some localized inflammation and swelling. Sometimes these reactions can last a bit longer if the bite was from a specific type of insect or if there's a mild infection setting in.
Really? I hadn't even thought about that. But wouldn't the antihistamine have worked if it was just an allergy?
Not necessarily. Sometimes, the body's reaction can be stronger, and a topical corticosteroid might be needed to reduce the swelling effectively. I would suggest trying a mild corticosteroid cream, triamcinolone acetonide, which is stronger than the hydrocortisone you tried. You could apply it to the affected area twice daily.
Okay, so just apply it directly on the swelling?
Yes, exactly, Mihira.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How have you been feeling since your last visit?
Good morning, Marcus. Well, the pain's still there, especially in my lower back. It flares up when I try to bend or lift anything heavy. I'm also finding it quite hard to sit for extended periods. It just feels like there's this constant, dull ache that won't go away.
I see. That sounds uncomfortable, Mihira. Let's dig a little deeper. Has the pain changed in intensity since our last session, or has it remained fairly consistent?
It's actually a bit less intense than before, but the stiffness in my back is still limiting my movement quite a lot. Some days I feel like I just can't get comfortable, even when lying down. I'm worried that I'm not improving as fast as I'd hoped.
That's understandable, Mihira. Recovery from back pain can be slow, especially if there's muscle inflammation or nerve involvement. Let's review your treatment so far. You've been following the recommended exercises, right?
Yes, I've been doing the ones you showed me, the pelvic tilts and bridging exercises, 3 times a day as you suggested. I also do the knee-to-chest stretches in the mornings. They seem to help a little with flexibility, but they don't seem to alleviate the ache completely.
That's good to hear. Those exercises target the muscles in your lower back and core, which are essential for improving your spinal stability. Have you also been using the hot and cold therapy we discussed?
Yes, I alternate between a heating pad and ice packs about twice a day. The heat seems to relax the muscles, but the cold packs help reduce the soreness after I've been active.
Great. It sounds like you're sticking to the plan. Now, let's go over a bit of your history to see if anything might be contributing to this slow recovery.
Yes, I had a neck strain about 2 years ago. It did resolve, but I occasionally still feel tightness there, especially when I'm stressed. I also had a knee injury last year, but thankfully, that's fully healed now. That makes sense. What kind of tests do you have in mind?
I'd like to perform a lumbar flexion test to assess your spine's forward bending capacity, as well as a straight leg raise test to determine if there's any nerve involvement. We may also consider a functional movement screen to observe your movement patterns in more detail.
Okay, that sounds helpful. Will we need to adjust my treatment based on the test results?
Possibly, yes. If we find that nerve involvement or excessive muscle tightness is a factor, Mihira, we might add some soft tissue mobilization and trigger point therapy to your sessions. I may also recommend you start with core stabilization exercises, like planks, in addition to the ones you're already doing. These will help build strength in the deeper abdominal muscles, which can provide better support for your spine.
All right, I'll give it a try. Is there anything I should avoid doing in the meantime?
Yes, avoid any heavy lifting, twisting movements, or prolonged sitting without breaks, as they can put additional strain on your lower back. Also, listen to your body. If you feel any sharp or shooting pain, stop the activity immediately.
Got it. I'll be careful.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihira talking to a doctor. Now read the question.
Dr. Francis, I'm calling about patient 427, admitted with acute abdominal pain and fever. Initial tests suggest a possible infection, but the specific etiology remains unclear. We've started broad-spectrum antibiotics as a precautionary measure. However, the patient's blood pressure is fluctuating, and we're monitoring them closely for signs of sepsis. Additionally, there's been a slight decline in renal function, likely due to dehydration and the underlying infection. We've initiated aggressive fluid resuscitation and are closely monitoring their urine output. The patient is also experiencing some respiratory distress, possibly related to the infection or underlying comorbidities. We've increased oxygen supplementation and are considering initiating non-invasive ventilation if their condition deteriorates. We're awaiting the results of blood cultures and urine analysis to guide further treatment.
Understood, Mihira. The fluctuating blood pressure and declining renal function are concerning. Keep a close eye on their hemodynamic parameters and adjust fluid therapy accordingly. Respiratory distress is also a significant concern. Monitor their oxygen saturation levels and be prepared to escalate respiratory support if needed. Once the culture results are available, we can tailor the antibiotic therapy to the specific pathogen. In the meantime, continue with the broad-spectrum antibiotics. Let's discuss again once we have more information.
Now look at question 26. You hear a nurse called Mihira talking to a patient. Now read the question.
Hello, Mr. Francis. How are you feeling today? The doctor has prescribed oxygen therapy to help improve your oxygen levels. Don't worry, it's a common treatment for many respiratory conditions. The oxygen will be delivered through a nasal cannula, which is a small tube placed in your nostrils. It's important to maintain a comfortable position and avoid moving the cannula too much to ensure optimal oxygen delivery. You may experience some dryness in your nasal passages, so using saline nasal spray can help alleviate this. It's also crucial to stay hydrated by drinking plenty of fluids. While on oxygen therapy, it's best to avoid smoking and exposure to irritants like dust and smoke. If you experience any discomfort or changes in your breathing, please don't hesitate to let us know.
I'm a bit worried about the long-term effects of oxygen therapy. Mihira, will it damage my lungs? And how long will I need to be on it?
Understandable, Mr. Francis. Oxygen therapy itself doesn't damage your lungs. It's a supportive measure to help your lungs function better. The duration of therapy depends on your specific condition and response to treatment. Your doctor will monitor your progress closely and adjust the therapy as needed. Remember, the goal is to improve your oxygen levels and alleviate symptoms, and oxygen therapy is a safe and effective way to achieve that.
Now look at question 27. You hear a surgeon called Mihira talking to a patient. Now read the question.
Good morning, Mr. Francis. How are you feeling today? The surgery went well, and you're recovering as expected. We've removed the drains, and your incision is healing nicely. It's important to keep the incision clean and dry to prevent infection. You may experience some discomfort, but the pain medication should help manage that. Remember to take your medications as prescribed and avoid strenuous activity for the next few weeks. I know you're eager to get back to your normal routine, but it's crucial to listen to your body and rest. Avoid lifting heavy objects and pushing yourself too hard. If you experience any significant pain, fever, or redness at the incision site, please contact us immediately. We'll schedule a follow-up appointment to monitor your recovery and address any concerns.
Thank you, Dr. Mihira. I'm just a bit worried about the scar. Will it be noticeable?
It's understandable to be concerned about the scar. While we'll do our best to minimize its appearance, it's important to remember that scars are a natural part of the healing process. Over time, the scar will fade and become less noticeable. However, it's crucial to protect the scar from sun exposure, as this can lead to discoloration. Always apply sunscreen with a high SPF when you're outdoors.
Now look at question 28. You hear a pharmacist called Mihira talking to a patient. Now read the question.
Hello, Mr. Francis. I'm here to discuss the medication for your burn scar. This cream will help to reduce the appearance of the scar by promoting collagen production and improving skin texture. It's important to apply it consistently as directed, twice daily, for optimal results. Remember to cleanse the scar gently before applying the cream. While this cream can significantly improve the appearance of the scar, it's important to manage your expectations. Scars take time to heal, and complete elimination might not be possible. However, with consistent use of the cream and proper sun protection, we can minimize its visibility. Also, please avoid exposing the scar to direct sunlight, as UV rays can darken the scar. Always wear sunscreen with a high SPF when going outdoors. If you have any concerns or questions, don't hesitate to contact us.
Mihira, will this cream help with the itching and redness?
The cream may help reduce some of the itching and redness associated with the healing process. However, if the discomfort is severe, you can consult your doctor for additional relief. Remember, patience is key. It takes time for the skin to heal and for the scar to fade.
Now look at question 29. You hear an ophthalmic consultant called Mihira talking to a colleague. Now read the question.
Thank you for your feedback, Dr. Francis. Your eye examination was thorough, and your patient interaction was professional. However, I noticed a few areas where you could improve. Firstly, while your refraction was accurate, you could have explained the process to the patient in simpler terms. Using analogies or visual aids can help patients understand the procedure better. Secondly, your dilation technique could be refined. A slightly longer dilation time might have provided a clearer view of the fundus. Additionally, explaining the purpose of dilation to the patient can alleviate any concerns they may have. Finally, while your documentation was comprehensive, it could be more concise and focused on the key findings. Remember, clear and concise documentation is essential for effective communication and patient care. Overall, you've shown strong potential. By addressing these areas, you can further enhance your skills and provide even better care for your patients.
Thank you for the feedback, Dr. Mihira. I'll definitely work on improving my patient communication and dilation technique. I appreciate your guidance.
Now look at question 30. You hear an occupational therapist called Mihira talking to a senior doctor. Now read the question.
Hello, Mr. Francis. Today, we'll focus on improving your upper body strength and fine motor skills. We'll start with some light weightlifting exercises to strengthen your arms and shoulders. Remember to maintain proper form and avoid overexertion. Next, we'll work on some hand exercises to improve dexterity and grip strength. These exercises will help you with daily tasks like buttoning your shirt and tying your shoes. Finally, we'll practice some functional activities, such as picking up objects and transferring them from one hand to another. These activities will help you regain independence and confidence in performing everyday tasks. Remember, consistency is key to recovery. Practice these exercises regularly, even on your own, to see the best results. If you experience any pain or discomfort, please don't hesitate to let me know.
Mihira, will these exercises help me return to work sooner?
While these exercises will help you regain strength and function, the exact timeline for returning to work depends on the nature of your injury and the healing process. We'll continue to assess your progress and adjust the therapy plan accordingly. Our goal is to help you regain your independence and return to your daily activities as soon as possible.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a cardiologist, Dr. Mihira, and an interviewer. Dr. Mihira, it's a pleasure to have you with us today. Let's dive into the fundamentals of body movement. Can you share your insights on why daily movement is so crucial for heart health?
Thank you for having me. When we think about cardiac health, many focus on diet or medications, but movement is an essential, sometimes overlooked, component. Movement activates the cardiovascular system, prompting the heart to pump blood more efficiently. This efficiency reduces the likelihood of plaque buildup, which is a significant contributor to heart disease. Beyond the physical, regular movement reduces stress levels, which plays an often underestimated role in heart health, as stress-related hormones like cortisol can increase blood pressure and cause inflammation. A consistent activity regimen helps balance these levels and maintains a calm physiological state. So, while nutrition is vital, movement is an irreplaceable partner in cardiovascular wellness.
That's fascinating. So, when it comes to the amount of movement needed, what would you say is essential for maintaining a healthy heart?
This is a nuanced question because the amount required can differ depending on age, existing health conditions, and lifestyle. Generally speaking, the American Heart Association recommends at least 150 minutes of moderate aerobic activity weekly, which can be divided into manageable daily segments. For most, that translates to about 30 minutes a day, 5 days a week. However, people often think this must be continuous, intense exercise, which isn't true. Shorter sessions spread across the day are equally beneficial, especially if someone is just beginning or has physical limitations. Interestingly, incorporating movement into routine activities, like walking to the store or taking stairs, contributes significantly to meeting this quota. For people with heart conditions, even small increments of light activity, such as a 10-minute walk, can be invaluable.
Very insightful. Now, Dr. Mihira, when thinking about diverse age groups, what kinds of activities would you suggest to keep everyone active and engaged?
It's essential to recognize that each age group has unique needs and physical abilities, so activities should be tailored to maximize both enjoyment and benefits. For children and teenagers, activities that involve play, like biking, swimming, or sports, are fantastic because they also build lifelong habits. Young adults might benefit from higher-intensity activities like running or weight training, which strengthen both cardiac and muscular health. Middle-aged individuals should focus on moderate aerobic exercises like brisk walking or cycling, perhaps combined with some strength training. For older adults, low-impact options are best. Activities such as Tai Chi, gentle yoga, or even dancing can enhance flexibility, balance, and heart health. The key is to find sustainable activities that cater to both energy levels and physical limitations, ensuring they enjoy movement rather than see it as a chore.
And for those who might have limitations or difficulties with these activities, are there alternative ways to achieve similar cardiac benefits, Dr. Mihira?
Absolutely. In cases where traditional exercise routines may be challenging, we look to gentler, more accessible alternatives. For instance, individuals with joint pain or mobility issues can benefit from water-based exercises like aquatic therapy. The buoyancy in water minimizes joint stress while still allowing for an effective workout. Chair exercises are another great option, particularly for elderly individuals or those recovering from surgery. Moreover, breathing exercises and meditation, while not physically intense, help with heart health by reducing stress hormones and lowering blood pressure. The beauty of these alternatives is that they offer cardiac benefits without requiring rigorous movement, highlighting that the goal is sustained, consistent movement rather than intensity.
Wonderful suggestions, Dr. Mihira. Let's discuss how to develop a regular movement habit. For someone just starting, what strategies can help them incorporate daily movement effectively?
Building a movement habit, especially if someone is starting from a sedentary lifestyle, is all about gradual integration and sustainability. Setting small, achievable goals is crucial. Beginning with just 5 to 10 minutes of walking can create a sense of accomplishment that encourages further movement. Another powerful strategy is to connect movement to daily routines. Simple choices like parking farther from the store, taking the stairs, or standing up for a stretch break every hour can accumulate over time. Social support also plays a big role. Engaging a friend or family member in a shared activity adds motivation and makes the commitment more enjoyable. Tracking progress, whether through a journal or a fitness app, can help maintain motivation by visualizing growth, which is an often overlooked but powerful reinforcement mechanism.
Thank you, Dr. Mihira. As we look to the future, what role do you see daily movement playing in cardiac health, particularly as technology and healthcare evolve?
The future of cardiac health will likely center on personalization and prevention, with daily movement remaining a cornerstone of both. Advances in wearable technology allow real-time monitoring of heart rates, blood pressure, and activity levels, giving people a constant reminder of their movement needs. On a broader scale, as our understanding of genomics and personalized medicine grows, we may be able to tailor activity plans to individual cardiac risk profiles. This could mean specific movement prescriptions based on one's genetic predisposition to conditions like hypertension or heart disease. Furthermore, as virtual reality and other technologies advance, engaging forms of movement may become available for those who struggle with traditional exercises. So, while technology is changing the ways we approach movement, the core principle, regular, intentional activity, is here to stay as a non-negotiable element of cardiac health.
Now look at Extract 2. Questions 37 to 42. You hear Dr. Norris Roger and Nutritional Research at Mihira Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. My name is Dr. Norris Roger, and it's a pleasure to discuss the current landscape of nutritional research at Mihira Healthcare Institute. At Mihira Care, we believe that nutrition is not only a fundamental aspect of individual health, but also an integral part of effective healthcare systems. Our primary aim is to bridge gaps in nutritional science, bringing practical applications directly to patient care, which will, in turn, enhance the quality of life in our communities. At Mihira Healthcare Institute, nutritional research is not just about evaluating different food groups or understanding basic vitamins. Instead, we're delving into complex interactions between nutrition, genetics, microbiomes, and disease prevention. Through Mihira Care's innovative platforms, we focus on comprehensive, personalized nutritional studies to reveal how specific foods and nutrients impact metabolic health, chronic disease risks, and even mental well-being. Mihira Care's focus on personalized nutrition is revolutionary, emphasizing nutrient recommendations that are customized based on each individual's unique genetic makeup, lifestyle, and gut microbiome profile. Additionally, our research utilizes advanced analytics and machine learning algorithms to study nutrient responses in the body, which is fundamental to addressing chronic illnesses like diabetes and cardiovascular diseases. This type of research is cutting-edge in healthcare, promising to transform how we understand nutrition as a preventative health tool and a potential therapeutic approach. The implications of Mihira Care's nutritional research on healthcare systems are profound. For starters, this research will likely reduce the prevalence of diet-related chronic diseases, ultimately lessening the healthcare burden. For example, by identifying personalized nutrient needs, we can prevent diseases before they require extensive medical intervention. Imagine the savings in healthcare resources if we could minimize conditions such as obesity or type 2 diabetes simply through tailored diets. Furthermore, Mihira Care's research could redefine healthcare from a largely treatment-based approach to one that prioritizes prevention. This shift could alter the healthcare model, moving from traditional interventions to nutritional guidance and diet-centric health maintenance programs. Not only does this approach reduce the cost of medical treatments, but it also encourages a healthier population that relies less on reactive care. In short, Mihira Care is not just treating symptoms, but addressing root causes by understanding nutritional needs down to a molecular level. However, nutritional research faces significant challenges. First, nutritional responses vary greatly among individuals due to genetic and lifestyle factors. Therefore, producing reliable, universal nutritional guidelines is difficult. Mihira Care aims to tackle these challenges by integrating a multifaceted research approach involving data from genomics, lifestyle studies, and extensive patient history to make accurate dietary recommendations. Another issue lies in the accessibility and cost of personalized nutrition. Currently, tailoring nutrition to each individual is a resource-intensive task that often requires expensive technology and testing. This can hinder broad implementation, as not all healthcare facilities have the capacity to offer such personalized care. Mihira Care is working to make such personalized nutrition affordable and accessible through partnerships with technology firms and other healthcare institutions, hoping to democratize access to advanced nutritional science. Looking forward, Mihira Care envisions a future where nutrition is integrated with other disciplines in healthcare to develop a holistic understanding of human health. The aim is to integrate our nutritional studies with other areas such as neurology, endocrinology, and oncology to investigate how nutrient balance affects various aspects of health beyond metabolic conditions. For instance, we are studying the link between nutrition and mental health, specifically examining how diet can influence cognitive health and mood regulation. Further, Mihira Care aims to expand the reach of its research by forming global research networks to share data, insights, and breakthroughs. By doing so, we can contribute to a global database that supports doctors and researchers worldwide, helping them make data-driven dietary recommendations that have a broader impact on global health standards. To realize this vision, Mihira Care is establishing several initiatives. Firstly, we're enhancing research infrastructure to conduct advanced nutritional studies and investing in genetic testing labs and computational tools. We're also forging partnerships with technology companies to develop easy-to-use diagnostic tools that patients can use at home. This will allow patients to monitor their health and nutrient needs more accurately, promoting continuous engagement with their nutrition. Moreover, Mihira Care is also focusing on educating healthcare providers, ensuring they have the tools and knowledge to apply nutritional insights in clinical settings. Only through a united front, involving physicians, researchers, and technology partners, can we bring about these changes. Finally, our ultimate focus remains on the patient experience. At Mihira Care, we understand that nutrition is an individual journey, and patient comfort and adherence to nutritional guidance are crucial to successful outcomes. Thus, Mihira Care's research places significant emphasis on making personalized nutrition both accessible and adaptable to individual lifestyles. This adaptability will ensure that nutrition becomes an integral, manageable part of daily life, promoting long-term health benefits without overwhelming patients with complex regimens. As we progress, our research will continually adapt to new insights, ensuring that Mihira Care's work remains relevant and impactful. The future is promising, and Mihira Healthcare Institute is poised to lead the way in bringing personalized nutrition into mainstream healthcare.
That is the end of your OET listening test. Now check the answers.